Purpose of this presentation is to explain dental filling procedure. Before we will go into details of each step on how to make composite filling, let's describe what exactly is a dental filling. It is a tooth restoration where dentist uses variety of materials to fill either tooth cavity, a fracture in a tooth, or missing part of the tooth. Two of the most common kinds of fillings are silver filling, where the main material used is amalgam as a mixture of metals, and second kind of dental fillings is a composite filling. It's tooth colored and main material used is a mixture of glass and plastic. In majority of the states, only dentists are licensed to do fillings. However, in Minnesota, some of the expanded duties dental hygienists are also allowed to perform this procedure. In this presentation, we will focus particularly on composite filling, also known as a tooth color filling or restoration. A restoration term stands for a filling, and it will be mentioned multiple times during this presentation. Here we will begin with steps of making composite filling. And the first step is anesthesia. Before we can start procedure, patient needs to get numb. To do that, dentist uses local anesthetic delivered by injection into the soft tissue that surrounds affected tooth. Whole purpose of numbing is to prevent pain and sensitivity during procedure. It takes about 5 minutes for anesthetic to take effect, and while we're waiting for that, assistant uses shade guide to determine shade of the patient teeth and pick closest matching color of composite to use for the filling. When the patient is finally numb, dentists begin to work on tooth preparation, and it is a third step into a dental filling procedure. He uses handpieces and burrs, common known as drills, to remove tooth decay and prep for the filling. And here we have already prepped tooth, all cleaned up, all decay is removed, and this tooth is ready for a filling. After a tooth is prepped, it's time to place isolation. It is an important step of the procedure because composite materials require dry environment, and excess moisture can affect bonding properties of composite materials. And here we have two ways to isolate the tooth. First is to place cotton rolls, gauze, use a suction to remove excess saliva, and a syringe to dry the tooth. And the second way is by placing a dental dam. Dental dam is considered as the most effective isolation technique, where we use this technique when two or more teeth are involved. After isolating tooth, dentists often needs to use tooth bends, especially when the filling needs to be done on the side of the tooth. Bends are used to maintain original shape and space between adjacent teeth. It's like fans that later holds the composite material in place. And on the picture number 1, we have example of a sectional band that surrounds only half of a tooth, and a wedge between which holds the band in place. On the picture number 2, we have a full band that surrounds entire tooth. It is also known as a Tafermeier band, and this kind of band is used for larger restorations. Now, when the tooth is isolated and fenced by the band, dentist will begin working on initial filling part. In the next couple steps, dentist will be using chemicals and materials that will form final composite restoration. In step number 6, we will get familiar with etching process. Dental etchant comes in small tubes with disposable tips, and it is between 30 and 40% concentrated phosphoric acid. It also has a blue color. As we can see on picture number 2, it gets applied to multiple teeth. It has to sit then for about 10 seconds before gets rinsed and dry with a water syringe. When applied on the tooth, etchant penetrates outer layer of tooth surface and prepares it for bonding part of the procedure. After etching, next step is bonding. Bonding materials comes in the form of a liquid. They often include primers mixed all together in one bottle. To apply a liquid bond, dentist uses micro brushes because they are small enough to fit tight areas of the tooth preparation. It only takes 1 drop of a bonding to place a thin layer on the tooth surface. After that, this layer needs to be dry and cure, and in order to do that, dentist uses curing light. This device produces specific length of light that activates bond and dries it. After bond gets applied, tooth is ready to be filled. First filling composite is called Flowable, and it gets placed on the bottom of a tooth preparation. It comes in a small tubes with disposable tips. As we can see, it's placed on the bottom of a tooth restoration. It has ability to seal microfractures in a tooth surface if there's any, and also it's easy to apply to hard reach places of the tooth preparation. At the end, it needs to be cured with curing light. It takes about 10 seconds for flowable composite to completely set. Final composite is the last layer of composite restoration. Its consistency is more like Play-Doh. This kind of composite is easy to form. Dentist uses a variety of dental instruments to pack and form that composite on the surface of the tooth. At the end, it also needs to be cured with the help of the curing light for about 10 seconds. Here are a couple examples of final composite restoration. We can see how cavity got restored with composite, how silver filling got replaced with white composite filling and how the spacing between the teeth got closed with the help of composite materials. Thank you.